topic, a very interesting topic. So I'm very thankful to all of you all that you all are present at this time of the day. So let us start. Preventive medicine, social medicine, community medicine, public health, and so many more names. This itself shows, are we suffering from any identity crisis? Maybe. In 2005, WHO Sierra, it was also discussed that in the Southeastern Asian region, the subject is going through some identity crisis. Today's student in this era of evidence-based medicines, they always look for hardcore clinical subjects rather than any soft preventive promotive methods. But whatever we say, this subject carries a lot of weight. We cannot think health without public health. We need public health professionals at all levels, without which we just cannot run the public health system. So discussing this to bring for capacity building, to encourage these young undergraduate students, postgraduate students we have as our audience, we have this panel discussion. The speakers are, I will call upon the speakers on the stage. First we have Dr. Tanushree Mondal, who is the Assistant Director of Medical Education. She is also Assistant Professor of Community Medicine at present posted at Shastra Bhavan, Kolkata. Dr. Anchita Patil, she is the National Program Officer for Reproductive Health, UNFPA Country Officer, working there with the experience of more than 10 years. We have Ms. Yolanda, who is the Socio-Anthropologic Scientific Staff at Leiden Academy of Vitality and Aging. Ma'am, please come. Last but not the least at all, we have Professor Rajesh Kumar, HOD of at PGI Chandigarh. Public health sector.
Thank you, Dr. Shamima. A very good afternoon to honorable guests on dais and off dais. I'm much honored today to be a part of the panel discussion for this August gathering with Dr. Anchita Patil, National Program Officer, Reproductive Health and HIV/AIDS, Dr. Yolanda from Leiden University, on this third International Students Meet on Public Health, a satellite event of 14th World Congress on Public Health 2015, a joint collaboration of Student Assembly of Public Health India, International Federation of Medical Students Association, African Public Health Students Association, and American Public Health Association on Students Assembly. Well, before the topic, I would like to introduce myself as Dr. Tanushree Mondal, presently working as Assistant Director of Medical Education, Shastra Bhavan, Government of West Bengal, and I will be talking upon career opportunities of young public health professionals in government sector, and I will be confining myself to administration. So, let me start with a picture of this great legend, none other than Dr. Bidhan Chandra Rai, who not only excelled as a physician, he was a stalwart in his stream, but he also made a great contribution as a policy maker. In this slide, I want to impress upon the youngsters that if a hardcore clinician can be a very good policy maker, then why we as public health professionals can't achieve this? Well, as you can see, this is a picture of the administrative building of Shastra Bhavan, where I work. So the topic of my discussion will be confined to the present scenario and hierarchy in administration, as well as the different scopes of training in the government sector. Well, administration and training may be two unique aspects, but they go hand in hand. Thus, they are the two sides of the same coin. How? If you ask me, then I would say that without training, there could not be good administrators. And an administrator can only bring up good administrators through training. Let me highlight something as an example. When we are passing MD Community Medicine or Preventive and Social Medicine, we come up with different career options. Well, some may join as a teaching faculty in any of the medical teaching institutions, maybe central government, state government or autonomous institutions. Some may join as a medical officer in different semi-government and private organizations. Some can also work as program officer in some esteemed international organization or NGOs. But some also try their hands in private practice as a clinician. Some also try their acumen as a scientist as well as a research fellow in their respective domains and the field of expertise. Well, you can see the pictures what I have mentioned, but can you please focus on this very aspect? Yes. Who are going to take the policies? Who is going to take the seat? What about the boardrooms? This is a big question. So, when we are thinking about who will conquer the boardroom as a policy maker, what we do with that thing? The boardroom becomes a boardroom. Okay. So this is the present scenario. Now, the question remains that if we look microscopically into the different aspects that are going around, we will find that any ongoing national programs or policies need three things. What are those? The services, the resources, and the partnerships. So in services, as we know, that we need good planning, implementation, and evaluation. In case of resources, human, drugs, equipment, finances, information, they provide a very good human resource. And definitely, we need a good collaboration that will bridge the gap between the private as well as the government sector. But a question may arise in your minds, why? What it reflects is that only 10% of our experience is gained when we read something. 20% is gained when we listen to something. 30% when we see something. What about 50%? Is a cumulative effort when we are listening and when we are seeing things. Similarly, 70% when we say alright. But what about this 90%? This 90% is when we are doing something. So when we are doing something by our own hands, when we are coming to the administration and not criticizing the administrators, doing the policies, framing the policies, we know where are the obstacles. Well, in my more than 2 years of experience as an administrator, people have tried to ask me that how you are enjoying your administration from, it was a total transformation from a medical faculty to an administrator. I thought I should do one SWOT analysis. Let's see what happens. I found that the possible strengths that I found is that there is a lot of gain in many of the skills, like communication skills. Yes. Patience. You have to deal with a lot of people from lot of arena, and there is a lot of exposure in this field. And yes, we have a deadline approach. This is not found in our medical stream. We are very much having a laid down approach. But there is a timeline. We have to finish the work. Like corporate culture, we have to finish the work within time. What about this weakness? Well, as we say, life is not a bed of roses. Similarly, it comes up with its own twists, ups and downs and stress. What about the opportunities? Lot of opportunities. Innumerous opportunities. And yes, last but not the least, we have the threats. The age-old misconceptions about that it is something which is to deal with a forbidden thing. Now, this is the next part of my lecture, which is depending on the training part. This is conducted by Institute of Health and Family Welfare in the premises of Shastra Bhavan, and they conduct certain trainings. I'll go very quick with this thing. Those of you who are wanting to have West Bengal health services and public health administration services, they are imparted this induction training. They also give some training regarding the disease control. For the teachers of the West Bengal medical education system, they provide this teachers training to impart the skills of micro teaching. They also give a hands-on skill regarding the IUCD insertion. And yes, you can go to the website and you can download the standard treatment guidelines, which is a comprehensive guide to the care and treatment of the very common diseases that we meet every day. So I have come to the end of my discussion, and I want to say that where there is a will, there is definitely a way. And this is a good platform to develop this will force. And I want to thank the organizers for selecting me as a panelist over here on behalf of the government. And I want to wind up with a song from a famous Nobel laureate, our very own, the pride of West Bengal, none other than Rabindranath Tagore, who has said, যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে একলা চলো একলা চলো একলা চলো একলা চলো রে Thank you very much.
Thank you, Dr. Tanushree, that was excellent. And just to add on the first part of her speech, that how realistic it is, that we had gone for a project to a district and we met with the Chief Medical Officer of Health. And he told me that being a teacher of community medicine, he told me that your subject is the one subject that is really helping me to run this district. And I felt so proud. And he also told me that during his undergraduate days, he did not pay so much interest to community medicine. He was more interested in medicine and gynae and surgery. But that, rather than those subjects are also helping. But the subject of community medicine is really helping him to run the district. So thank you, Tanushree, for mentioning once more. So our next call upon our next speaker, Dr. Anshita Patel, who will tell us about the international organizations.
Thank you so much. So when I was invited to when I was called upon to talk about this issue, I was pretty much interested, because when I joined my MD in community medicine, I was told I was one of the rare species who had actually selected this topic. And I'm so glad to see so many of you. And in fact, when the organizers told me that there is a rush for this session, I was actually pretty nervous coming around here. So excuse me guys if we falter and if we don't encourage you enough, but that's the attempt here, to encourage you to come forward, to work in public health and make public health a stream that people opt for. The second thing that I would like to say here is a disclaimer. All the thoughts that are presented here are mine and mine alone, and they do not belong to my organization, which is UNFPA. Any resemblance therefore is purely coincidental. So, and that's very important. Just bear that in mind. So I would just like to, when I was asked to talk about international organizations, it seemed a little difficult, but quite apt for me, because this is what I have been working on for the past decade or so. And I have worked with various organizations in various capacities. So I was just thinking, about what should I present to you people when we are talking about international organizations. And I thought, let me give you a brief overview of what we really mean by international organizations, what skills you need to have if you want to join these international organizations, what, I can't say really career pathways, but what types of organizations are there, and so on and so forth. So I will try and make it as interesting as possible and not in a lecture mode. So just bear with me for some time. Okay, so basically what I thought about that, when we talk of international organizations, there are basically two streams. One what we call the donors, and one what we call the implementing agencies. So the donors are the ones who give the money, who donate the money, so to say, and the implementing agencies are, should I say, who do the real work? Well, that's not really true. Okay, but there is no clear-cut difference between the donors and the implementing agencies because at times there is an overlap. Nonetheless, I have tried to make the difference. For example, even within the donors, there are a few streams. The first one that we all know of are the multilaterals. These are the organizations that are not country-specific, that say, so to say, belong to the world, and primarily UN. So I think joining the UN is the dream for many public health professionals. It was my dream too, so I can say a lot about that. Within the UN, there are n number of agencies, funds, and what have you may. But there are 3 or 4 that are working in health. Can you name them? Anybody? Which UN organizations work on health? Hey, give me one, the most obvious one. WHO. UNICEF. Thank you for naming my organization. Thank you. Yes. So I would primarily name these 3, yes, and then there is UNAIDS, which is a joint UN effort on AIDS. Then there is the World Bank family, which works on health as well as many other issues. And then there are some certain areas like the Asian Development Bank, which is also multilateral, but that's not really working that much on health. It's working more on poverty elevation and other issues. But we know that development, once you come into the sector, you'll realize that all these issues are interlinked. So it is possible that an organization which is, say, not directly working on health may seek somebody, with a health background, because, say, poverty and health are interlinked. It's a cause and effect relationship. Then there are the bilaterals. And well, I must also say that these logos are not all inclusive. There are many, many more. These are just examples that I'm sharing with you, especially given that I am an Indian. So these are the ones that are, more have more of a focus in India. So the bilaterals are basically where the funds come from one country for another country. So it's a bilateral. It's an agreement between 2 countries, unlike a multilateral. So primarily in India we have USAID as one of the biggest bilateral donors. That's the American Donor Agency. Then we have UKAID, and they have the Department for International Development, or what we call DFID in short. Then we have JICA, that's the Japanese organization. And while USAID and say UKAID work more in a grant mode, so which is like, what we call donorship, JICA works on a loan basis primarily. So it gives loans to our country. Now, this is one area that's coming up in the donors, and that's the foundations. And we have the Bill and Melinda Gates Foundation logo right there also. We have the Packard Foundation, we have the MacArthur Foundation, and there are a number of foundations. There are Indian foundations who might not be called international because they might not be supporting efforts internationally. But most of these donors do support international efforts too. Then coming to the implementing agencies, who do the real work. And well, before I say, because there's no, clear-cut line, I must add that the UN especially sometimes also works as an implementing agency. And that's because the UN per se does not have any money of its own. What it gets is from various donor countries. What it also gets is from the various bilateral organizations. For example, if WHO is running the polio program, a large chunk of its funding would be coming from USAID and from the US government. If we are working on reproductive health, by we I mean UNFPA, we get a lot of funding from Netherlands. So these are a few countries that fund us either through the bilateral program, or the country funds reach directly to the UN organizations, and that is then distributed across countries. And so in that sense, the UN itself becomes an implementing organization because now we are responsible to the donors who are giving us that money. But in the black and white world, the implementing agencies would be primarily the international non-governmental organizations. And you would notice that there's a blank here. There are no logos because there's so many of them, I didn't know which one to put. It just seemed a little, artificial to put any logos here. But there are a large chunk, and a number of the international NGOs that are working in India are actually US based. And that's primarily because I guess initially USAID funded Indian projects through the NGOs working whose headquarters, I should say, are in the US, and that being the primary organization, so it was funded through that. So a number of those agencies have found their way into India, and a number of them now actually have built up their Indian offices. For example, CARE now has a CARE India. So these kinds of intra-health now, I think, is coming up with an intra-health India. So all these organizations are now developing their India offices. Then we have the academic institutions like the Johns Hopkins University, Baltimore. Then we have the Chapel Hill, and I've also put in the very latest organization or the academic institution, that's the Public Health Foundation of India, especially for my Indian friends out here. This is an agency that was set up primarily to promote public health in India, and believe me, it is getting a lot of funding from many organizations. It is an implementer, it is a research organization, and you name it and it does that. Then we have certain consulting firms which offer consultancy services to our organizations. EY does quite a bit of it. For example, McKinsey does a lot of strategic planning, etc. for health sector. We don't usually associate these with it, but these are international consulting firms which do work on public health is one of the areas of their work. And again, a very latest one on the anvil is IPE Global. This is an Indian firm that has been around for about 6 or 7 years now, or maybe a decade, just about a decade. But now it is working across, I think, over 50 countries. And it also has certain donor-funded projects that it's running in India. So broadly, these are the kinds of organizations that you can work with. So you know that you have a vast arena to play around with. One is, of course, with the government, as Dr. Tanushree mentioned, and then if you want to go to the international side, these are the kinds of organizations that you can look for. Now, what are the kinds of, say, staffing arrangements or modes of engagement that you can have with them? You might see that I've put staff, and there's something called non-staff. Well, I'll come to the non-staff bit later. So when I say staff, what do I mean by that? By staff, I mean anybody who joins the organization, and to put it bluntly, gets benefits. So benefits in terms of medical insurance, benefits in terms of travel allowances, benefits in terms of, say, pension or provident fund. So all these benefits you would get if you are a staff. Yeah, and the biggest benefit, you get an email ID with the organization, which a non-staff will not get. So if you're with WHO, your email ID, my email ID would perhaps read as partil@unfpa at who.int. See how clued in I am to my organization. Every time I say that, I land up saying UNFPA. Okay, so that would say who.int, that's international. With our organization, it would say unfpa.org or unicef.org. That happens only if you're a staff member. Now, what kind of staff members do they have? So they have somebody called permanent or regular staff. And as far as the UN is concerned, most of us are on what is called fixed term contracts. So we are permanent practically, but we have contractual appointments for a year or 2 years or sometimes even more. It's for a fixed term. And they get renewed, say, after the 2 years get over, your performance being absolutely fine, it would get renewed automatically. For many other organizations, say the implementing organizations, permanent is permanent. You might have a small, say, probation period to work with them. Then, especially with the implementing organizations, you have something called project-based staff. For example, if, say, IntraHealth gets a project from USAID, which is a 5-year project, and it's X million dollars or whatever, they would need to hire staff specially to run that 5-year project. So you are on a long-term assignment and you are a staff of IntraHealth, but for those 5 years. So your email ID, yes, would read intrahealth.org, but it's for a limited duration, and that's how your contract will be drawn. But even then, you would get your benefits, and that's why I'm saying you are staff. Okay, coming to the so-called non-staff. Now this is the term I heard when I went to headquarters, and I found it pretty funny, and that's why I put it here. But basically by non-staff we mean there are a lot of consultants that are there. The consultants usually do not get the benefits. You get a fixed salary, a lump sum salary, If you're traveling, you might get some travel allowance that varies from organization to organization, and you definitely do not get the email ID. So you would be working on your personal email ID, practically in your personal capacity. Even within the consultants, you have a full-time consultant. So you have somebody who is there, who's working, from 9 to 5, sitting in that organization, but does not get any benefits. There are these arrangements. Then you have a part-time consultant. For example, you might have somebody who's devoting 5 or 6 days to a particular project on a regular basis. So that's a part-time. So you have a contract drawn up which says 6 days of your work is going to be given to XYZ organization. And so you're a part-time consultant with them. Then the third one is pretty common around here, where you're seconded to other organizations. And this is where there is a mix between, so to say, the international organization and the government organizations. International organizations very often hire technical expertise. By hire them, I mean they pay for that technical expertise. And these technical experts, which is all of you guys, are situated within, say, the ministry or within the health department. That's where you're situated. So the payment, say, would be made by UNFPA, but you would be sitting with the health department and you'll be working with them, and your supervisor would be the health department. And then there are the last types of consultants, which are assignment based, and these are something that a number of freelance consultants do. So if I'm supposed to, say, conduct a study, or say write a project report, I should say. Okay, so I might just hire a consultant and say, can you visit here and just look at what was happening in the project and write a report on that. So, and the consultant say it will take you 10 days, 15 days, and once that assignment is done, you give a deliverable and you take your money, and that's it. So that's how also, that's another option where you can work. And I can say all this because I worked out of these 6, I think I worked in at least 4 of these positions. So all of them have their pros and cons, which we'll perhaps be coming to later. But primarily, I would be focusing on the staff bit of it, and a lot of my presentation would be on the non-staff, but not to the secondment and the assignment based, because that's a slightly different story. Now, how are you recruited? I think I'm sure all of you would be very interested in how you can join these international organizations. Okay, so if you want to join as staff, well, it is advertised. Keep a lookout. For India, we have DevNet Jobs India, I think, .org. DevNet per se is one of the biggest portals which puts out ads for the development sector, including public health. Then we have DevX, and you have new websites that are coming up, which basically will show you the jobs. So for staff, all these organizations will advertise. There is hardly anybody which allows you, say, a backdoor kind of an entry. That usually, I would say 99% of the cases, does not happen. It is advertised and it's a very transparent kind of a selection. There is a rigorous selection process, yes. So there is something called the long listing of your CV. What do we mean by that? This is usually done by the HR department. So if we say we want somebody with a PG in community medicine, or because I worked in RCH, so we do ask for a post-graduation sometimes in Obs and Gynae. So a PG in community medicine or Obs Gynae, etc., with 5 years of experience is necessary, and experience of working with the health sector is desirable, etc. So they look at the essential components. So anybody who fits in, okay, as a PG, 5 years, long list. PG, 5 years in. PG, 3 years out. So that is what they do. Now, in the shortlisting, then the technical team usually comes in, and they will take a close look at the CV and see what experience this person has, which matches the need of the organization. And then they will do a shortlist. Usually, most of these organizations then go in for a written test. The written test is more theoretical, and it's actually, writing is perhaps not the right word. I mean, writing is not in handwriting. Well, they are all typing tests. Okay, so you have to sit on a computer and type out these. They are limited time frames. Some of them allow you to do it from home. Yes, don't be surprised. They allow you to do it from home because you're supposed to submit it in 1.5 hours. So there is no time to do a Google search, guys. And if you do it, well, you part of your job. So if you know how to Google search and Google search quickly and get the responses, you are good and you deserve to be selected. Then, of course, there's an interview, face-to-face interview. In the interview, usually what they ask is more application type of questions. Well, organizations can vary. Some do ask very, very theoretical questions. So what do you think is the connection between sexual health and HIV/AIDS, and where can you draw the line? I mean, these are very theoretical questions. Okay, so condoms are used in both and blah, blah, blah. And so you can go on and that's right. But you might have very difficult questions in the interview also. But in the interview, always bear in mind, please read up about the organization, its mandate, what it works on. That's very, very important. Okay. Because without that, you're not going to be in the mind frame of giving the organization, giving the kind of answers that they're expecting from you. Because the people who are interviewing you have been there for donkey's numbers of years. So they are already in that mindset, which you may not be. And of course, then there's an official reference check. This is very important for some. No, all organizations. Now, this is a place where sometimes people falter. You might have done an excellent written test, you might have done an excellent interview, but a reference check shows you that you are not a team player. Yes, people have been rejected on that. So they might go in for the second best one. Because as we have said, people are selected on their IQ and they are forced to leave the organization because of lack of EQ. What is EQ? Emotional quotient. So you are selected on your intelligence quotient, but you leave because of lack of emotional quotient. So a lot of your ability to work with a team, your ability to accept your mistakes, etc., is also very important in these organizations, because a lot of their HR rules are very, very strict on these issues. Say, I am not allowed to shout at my colleague. If my colleague reports that I have been screaming at him or her, I can be thrown out for misdemeanor right then and there. Okay? So that's where we are. For the consultants, either it's the same process that it's advertised, etc., etc., especially if it's a full-time consultant, or if it's one of those, short-term assignments, then it might be by word of mouth. And that is when I was talking about these assignment-based ones. So somebody says, this person is good, so you want to get a report written, call him or her, and he or she will do a very good job. So what they usually do is, can you share with us some previous work that you've done? So do keep something, if this is the route you want to go through, do keep something handy with you, maybe a 2-pager, 3-pager, something that you've written, or some analysis that you've done, and show what you have worked on. And they might call you for a face-to-face interaction, unless of course you're very well known in the field, then well, people know you. Now, coming to what skills are required. Of course, you do need to know your subject. And when I say know your subject, we all know how vast our subject is. So somewhere down the lane, you have to make super specialized in these fields. That you cannot be an expert on all fronts, because this is one field that is progressing so fast that it's impossible to catch up on the whole arena. So you do have to specialize. And whichever area you're going through, you should know your subject in the technical sense. You should be aware of field level realities. And when I say field level realities, I mean the health system. You need to know that. I remember an incident where I was part of an expert group meeting which was talking on adolescent health and the delivery of adolescent health care in India. And they said, oh, at the sub-center level we should have screening and this and that. Sub-center level screening? So we had this very senior person, a non-public health person, who said, oh, you can't have that. He said, ma'am, we don't have that kind of human resource at the sub-center level. Okay, so can you just briefly tell me what kind of human resource are there at various levels? Okay, so that is where it starts. So here we are working on developing a national level strategy on adolescent health care. And we have experts sitting here who have absolutely no idea how the health system functions. How can we even develop a policy? And I'm saying this because they were the clinical experts and we are the public health experts. And we are the ones who hold the expertise in these field level realities, who can say, sorry boss, cannot be done in India. Sorry boss, take that with a chill pill. This is difficult. Okay, so these kinds of things is something that you should be aware of, and it is our responsibility when we are on the policy making side to bring that kind of a perspective into our decision making. Yeah, another thing that you should be very familiar with is computers. It doesn't work without it, and I'm sure with this Gen X, everybody is familiar with that. And I don't mean only Googling, okay? I mean you should be able to work on MS Word, MS Excel, MS PowerPoint, not MS Dhoni, okay? Then you need to have the gift of gab. And what do we mean by that? Exactly what I'm doing right now. You need to be able to talk. You need to be able to keep your viewpoint across, clearly, lucidly. But that does not mean that if you don't have a viewpoint, you should speak. So I have faced this, friends, and believe me, it's very embarrassing when people say things and you realize, what was that? You know, does it even make sense? So in public health, we have this very interesting phenomenon of new catchwords of the season. Okay, it keeps on coming up every time. I remember there was a time when everybody seems to be talking of sustainability, scalability. I mean, we still talk about it, but those were new terms. They were talking of leveraging funds, and we had people, you know, inserting these words into each and every sentence. Forget making sense in public health. The sentence did not make sense in plain English. So please don't do that. There is always a time to speak. There is always a time to listen. If you are not familiar with a subject, a concept, listen. Because, for example, you might be familiar with the technical side of things. You might not be familiar, especially initially, with the program side of things. Let me give you an example. When I joined a particular job, there was work on nutrition on iodization of salt. Now, one would think, you know, the states in India where salt is iodized would be where iodized salt is most easily available. So if the work is happening there, it should be available, and if there are no iodization plants in, say, state Y, well, you won't get iodized salt there. It's completely the reverse. Because within the state, the salt is transported by road, whereas outside the state, the same salt is transported by railways. There is within the system a very rigorous check on salt that is transported through the railways, which means what reaches the distant states is properly iodized salt. But there is no rigorous check for the roadways, which means what reaches within that state has less iodine actually. So the states where the manufacturing is done are more prone to having, you know, improperly iodized salt. Now, who would have thought of that unless you were in the programming? So please listen, keep on learning. Such are the things that you will, once you get out there into the world, you will keep on listening to. And most importantly, networking. This is a tough one actually, especially for people who are a little introverts. You have to be able to learn to just walk up and say, hello, I'm so-and-so, and this is where the organization I belong to. You have to be known in this field, out of sight, out of mind. If you're seen in multiple meetings and you make your presence felt, people will call you, people will talk to you, and that's how you learn and you will keep on growing. Now I'm just coming to a few features of what it means to be working with donors. I've tried to make a traffic symbol out of that. You know what, from my perspective, I felt were the goods, the bads, the uglies. So the good is, if you're working with a donor, where you are the one who's giving the money, you get to decide the agenda. I will decide what I want to pay for. As the program officer in reproductive health, I'll say I pay for this, I don't pay for that. Of course, there's a lot of travel, and that's, if you enjoy traveling, that's a pretty good thing. And then, because you're in the international sector, you keep on getting all the international technical updates, because your emails are almost spammed with, you know, updates from your organization to say XYZ is doing this, and look up at this project, and this is the new thing that has come, or this is the new contraceptive that has been launched, and you know, so every day we are boomeranged with all this. What kind of role would you have? And I put this in orange because you might enjoy this, you might not enjoy this. One is the advisory role, where we are the technical experts, because we are working with international organizations. We're supposed to have that expertise, and that's why the first point, know your subject, where we advise usually the government and, you know, other organizations. And then of course is project management. If you're giving the money, you have to manage the project. Now this is a tough one. Can somebody tell me what was the second point that I said when I started the presentation, which I said was very important, which relates to adherence to organization's viewpoint? I made a disclaimer that what I'm speaking is not my organization's viewpoint. So in fact, if you read a number of text publications, they say the views expressed here are that of the authors only and do not necessarily, But then, this is one, but then there are challenges because certain organizations do not, well, most international organizations have very noble intentions. So it's easy to adhere to the organization's viewpoint. But some places you falter. For one of them, for example, in the reproductive health arena is the issue of abortions. It's a very sensitive issue. Agencies say like USAID do not support that. They support post-abortion care, but they will not support any promotion or lobbying, etc. for abortion, and we have very strict laws on that. So, to attend a meeting on safe abortion is like, if you're a USAID staff, is walking on thin ice. Okay, you have to be very, very careful on that front. That's just an example. There are more, okay? And then the reds for me, you are far removed from implementation. So you can't really, because you're the funder side, then you've given the money to somebody. Who's going to do work in the field? Sometimes there are multiple levels, so they would give out to another NGO lower down. You're far removed from the actual implementation. You can't see the results of your activity. And yet, there are no promotions there yet. You have to reapply for any senior position. It's not that, hey, you are good, we are going to promote you. That doesn't happen. It's the positions which are graded. Any new position which is at a higher grade, you have to apply for that. If you're selected, well and good. Otherwise, you stay where you are. So that's a big, big drawback. With the implementing organization, some of the things which are, of course, the joy of implementation. And if you are implementing, you have obviously the opportunity to share the results of what you worked on the project. So it's usually the implementing partners you would see who are making these presentations on the results of certain projects, etc., not the donors. Then, of course, their role would be technical, evaluation, management, these kinds of roles that they have. Yeah, the bad thing, they have multiple bosses. So they have, supposing IntraHealth is working in India, I'm saying IntraHealth again and again. I somehow tend to like that name. Okay, so IntraHealth is working in India, so one of their bosses is IntraHealth headquarters, which is located in the US. And now the other boss is the donor who's funding them. And the third boss is the government, because they're working with the government. So they have to be responsive to all of them, and sometimes it can be a really, really challenging task. And of course, there is donor dependence. No donor money, no implementation. They don't have any money of their own. Project shuts down, you have to let go of stuff. Sometimes projects are shut down prematurely. Suppose in this era of, when we had this economic downturn, well, there was lack of funds overall. So projects were shut down. Okay. Just coming to the end, so the reality check. If you're thinking that this is what you do in international organizations, dress the way I am. All suited, booted, looking very smart, maybe jet setting all over the world. Sorry guys, that's not going to happen. You're going to be in front of the computer most of the times. And you can ask my colleague who's sitting right there. I do not usually like this in office. I have my hair all tied up and then on the computer because I'm preparing presentations, I'm preparing documents, I'm preparing reports, etc. That is what you learn. So don't have any lofty, visions of what you'll be doing in international organizations. Secondly, just because it's international doesn't mean you're going to be paid in dollars. And big money. No. If you're working in India, whichever country you're working in, if you're a national staff, you're going to be paid in dollars. Okay? So just bear that in mind when you're applying. And if you have any questions, even after the session, well, there's my email ID and you can contact me anytime.
We the public health professionals, whenever we tell someone we are MD community medicine, next thing, you can join WHO with their good pay packages. You can join UNICEF, there are good pay packages. So these things you can please contact Dr. Amchita, she's told a lot. And she's cleared some of the myths also, right? So next we call upon Ms. Yolanda. Till now we have been talking in the scenario in India. So we whether detest or not, we are talking about a developing country. So we have someone in the developed country to tell us the situation of public health over there.
Okay. So first I'd like to thank everyone for the opportunity for letting me speak here. And I thank my esteemed colleagues for giving such insightful information on the government and the international NGO world first. Now, I've been asked to talk about public health careers opportunities abroad. Now you should wonder who I am. So my name is Jolanda Lindenberg, and I'm one of the scientific staff members at the Leiden Academy of Vitality and Aging. It's a little knowledge center which is attached to the Leiden University Medical Hospital and the Leiden University in the Netherlands. Our kind of mission and aim is more directed towards the public health of older people, as you can see from this picture. And so I'll be discussing a little bit in general on public health career opportunities abroad. And then I'll be speaking a bit more in detail about what I know from the Netherlands, because that's basically my frame of reference. Why is this important? Why do we work on elderly? Because both for the developing and in developed countries, elderly are an increasing proportion in the population. And they need very different care, they need very different approaches, so that's why we work on the elderly as well. And even in India, if you look at the proportion of elderly in the population, it's increasing steeply. And by 2025, it's expected that around 20% of the population in India will be elderly people above the age of 60. So it's something that is in the future, perhaps maybe already here, but something that might be a career opportunity for you guys as well. So then from the public health professionals, sorry. I'm fine, it's okay, thank you. I looked at the website, American Public Health Organization. So basically this refers to their website, but if you look at what public health professionals do, it's very, very diverse. And that's also related to the talents that they get during their educational trajectory. So they learn how to measure and track health status, to identify health problems, both on the population level, on the individual level. They learn how to evaluate and research projects. They learn how to report on that and convince stakeholders of the importance of what they are doing and how to change this. On the other hand, there's also the implementation side, so they know how to implement changes and how to evaluate those changes. And they also educate others, of course, so they train public healthcare employees and they evaluate health services, and a large part of their work is research. So internationally, this means that public health professionals have a very diversified talents and expertise. And this is one of the challenges that public health professionals are posed with. So how do I distinguish myself in this large, enormous amount of public health professionals coming about every year? And this is something to consider during your undergrad and graduate studies, I think, that you have to choose a certain skill, a certain expertise that distinguishes you and that enables you to pursue your career opportunities. So part of what you need to do as a public health professional is to distinguish yourself. Now, what are the benefits of an international career? They can be varied. First of all, you can acquire unique knowledge and experience, as the talk just now clearly portrayed. If you're working in an international NGO, obviously you have very different expertise and knowledge, which sets you apart from the rest. So, unique knowledge and experience. But you also become flexible because you're working in a different environment, you're used to dealing with different people from a different backgrounds, so you can deal with differences, you can deal with changes in your environment, and you can deal with challenges, so you become more flexible, so to say. One important trait that public health professionals learn from an international career opportunity abroad is that they learn to communicate across different cultures and in diverse circumstances. Now, this is very important. Not every communication style is the same in every country, and not the expectations are very different, and you learn to adjust to that, to read different communication styles. And there's an additional benefit. You get access to a unique network of potential employers and cooperation partners. Even as a graduate student or an undergraduate student, you will be coming into touch with different people than you would usually encounter in your own country. And those people might help you in your future career. So you can get additional accreditation, both abroad and in your country of origin, from international organizations or from educational organizations abroad. Sometimes for shorter terms, sometimes for longer terms, but they do gain you unique knowledge which you might not find in your own country. And one more important benefit is, of course, you get to know a whole world of friends, and, which is very different from having a one country-based network, is that whenever you travel you will meet someone that you actually work together with or got to know during your time abroad. So such an international career has many benefits, of course, but it also has its downsides, and I think some of them have been touched already. And one more additional benefit, sorry. You learn one or more languages when you stay abroad. It can be a good benefit, and also an expertise or skill that you can usually put on your resume or distinguish yourself from others. So the challenges of an international career. A benefit, but a challenge is also dealing with those differences. Some differences you might, from your own frame of reference, not appreciate, and others you might be able to deal with. And they're not always fun to deal with. Missing family and friends, that's a big challenge, especially abroad, of course. On the other hand, having an international network of colleagues and friends also means that you will miss most of them at parts of the time, so that's another challenge. Big challenge, which some people also don't know how they respond to, is if you come abroad, feeling at home in different places can be a challenge. It can be a challenge once you arrive there, because you will feel a bit displaced, I think, most of the time. And at the same time, when you come back, you will also feel somewhat displaced because things have changed in your own country of origin. And on the other hand, you're not feeling at home maybe as much as before. Although this usually goes away, you will still feel that your second home is somewhere abroad. So you can feel at home in different places. That's a good thing, but it can also be kind of a negative factor in having an international career. Now, what are potential employers once you reach this international, if you look at international opportunities? They're quite alike what you would find in a local environment, I think. So there are federal and national public health governance bodies. So these include the governance, some kind of national health organization, but also on a federal level. There are public health departments, whether international, national, regional, or local. Then there's, of course, academia. There's large bodies of research that need public health professionals. Hospitals and medical institutions are more and more, especially in the developed world, looking for public health professionals. And that's also because, especially in the developed world, curative care is increasing in cost. And those costs are so high that they're turning more towards preventive care. And part of preventive care is, of course, what community medicine and public health professionals are best in. So they're turning more and more towards these kind of professionals. And those also include care organizations, such as institutional care organizations, residential care, assisted living facilities, nursing homes, rehabilitation centers. These kind of centers are also looking for public health professionals more and more in their outreach activities. Then there's, of course, non-profit organizations, including the NGOs, which has been delved into quite some detail, so I won't delve into it. And then finally, there's the corporate sector. So these include the consultancy companies that have been mentioned. There are very many international consultancy companies, but there are also some Indian ones which might need them. And then finally, there's also insurance companies, which you can turn to. There's some insurance companies also working globally, exploring new countries or developing countries that are implementing insurances. They need public health professionals to look into, okay, how do I now estimate which population groups are at risk for certain diseases and what kind of health insurance should I offer them. So these kind of companies are actually looking for public health professionals. Now, from my personal experience, I can only discuss the students that I have in the Vitality and Aging Master Program, which is a Master of Science. It's a postgraduate Master of Science, and we have half of our students are international and half of our students are Dutch students. And if we look at their careers, so these are the results from 4 years of our alumni. So half of them actually end up in science. And that means lots of them are actually having PhD positions or assistantships as researchers. About a quarter of them end up in medicine. That might be specialization in medicine. Sometimes it's non-educational career paths, such as an assistant in some kind of internal medicine department or some other kind of public health department. And there's smaller amounts of the students who end up in further specialization or health advisory bodies. So these include public health departments, ministries, NGOs, and these kind of things. But what we do find is that 90% finds a job within 3 months after graduation. And this is partly because they have this additional master, which distinguishes them from the rest. So how do you get an international career, which is basically the question that you want to know, I guess. So first is education. Get yourself additional education. Any kind of education might distinguish yourself in an international career path, preferably an internationally accredited organization, of course. Another option is internships or experience, and that might be unpaid internships, especially if you want to work in NGOs or international non-profit organization. An internship might be a first real signal to the employer that this is someone who's genuinely interested, who has some skills that might benefit my organization. Another way to distinguish yourself is unique knowledge. So that might be specializing in a certain group, in a certain problem, either preventive medicine in some kind of population, or for instance, specializing in the elderly. That sets you apart from the rest. Another way to make sure that you're kind of attractive to an international career is finding widely applicable skills that you can actually put in your resume and make relevant for that organization or that institution that you want to work in. So if you can show that your experience fits that organization, that's very important. As been mentioned before, networking, of course, is always good. So some words of advice. These are purely personal experience from what I see from my students who've been graduating over the past few years. Is important is focus. Try to focus on what your passion is. This sounds a bit kind of idealistic, but I think part of those people who are successful are those people that actually find something for which they're passionate, because that really shows through in your work. It shows through in what you choose for kind of your educational career path, but it also helps you to keep you motivated during your job, and even when it's, you know, perhaps that unpaid internship, but it is a topic which you're really passionate about. That's very important. Try to find a unique profile. Even if you're working on assignments for your master's degree or for your PhD, try to find that topic that is very important now, or maybe will become important in the future, and stick to that topic so you have specialized skills. One important advice for especially letters of motivation and resumes: try to match your resume. Do not just give a random resume and letter to any kind of employer. Instead, try to look at what this employer finds important, what its mission is, what kind of people work there, what kind of projects do they work on there. Can I fit my resume in such a way that it fits those? So put the most relevant things on top. So if this is an international organization working a lot in research, put your research experience at the top of your resume, not your educational pathway, okay? And then try to detail what you did in this research. I know, research implementation, I use these kind of methods, okay? Because that's important for that organization. And perhaps less important is your educational background. So try to match that, and the same thing for your motivational letter. When I look at motivational letters that come in, most of the letters go kind of in the, I'm being a bit overstating, but still, it kind of goes like, I am this person, and I did this and this and that, and I think that's very important. So this is a very centered letter on the I. But what I want to know as an organization is also, okay, you are this person. So what can you contribute to my organization? And why do you want to work in my organization and not the next one? So that's important to distinguish in your letter too. Important is also to seize opportunities. Whenever you see an opportunity, try to do it. Even when you don't have the confidence to immediately step forward, just go ahead and try. It's it's from mistakes that you learn the most, and that's the only way you can get forward. So that's an important point. So I think I'm finished with my 15 minutes, so I will leave it to this. If you are interested in any of the things I just said, come on over and ask a question when the time is
Ms. Yolanda, all of us do dream of an international career, right? Going abroad just for vacation doesn't sound good. If we have an international career, we all dream of it in some part of our life, right? So now coming to the scenario in India, where 30% of patients die without seeing a doctor and basic health services are not accessible to all of us, we have a very renowned person, sir, so who will speak about Dr. Rajesh Kumar, who is the head of the Department of School of Public Health, PGI Chandigarh, who will talk to us about public health in the health system. So, sir, just to inform that sir was informed about this discussion about an hour before this started. So, sir is all prepared. Yes, sir, please.
And thank you very much for giving me this opportunity. I think we have had 3 excellent presentations, and all of us are listening to that. I think we have a little bit time to listen from you. That what do you think? Are there enough opportunities for a public health professionals, or you think that there are less opportunities? What is your opinion? May we have few questions from you? I think that will be a better way, because I am an old guy. I don't know the state of mind of the youngsters. What do you think are the issues for career or for opportunities? As far as I am concerned, I think there are lots of opportunities, and opportunities are more than enough. What I hear, when sometimes I work in a teaching institution, I teach. So when students graduate, many times they come to me and they say, "Sir, what should I do? I have this job, I have that job, and I have this job. Which one I should choose?" Many times they come to me like that. I have these 3 or 4 jobs, but which one is better for me? They generally come for that kind of thing. So what do you think are the issues? Yeah.
Hello everyone, this is Dr. Param Satpathy from Grand Medical College, Mumbai. My question to all the panel experts over here. Since we are discussing about career opportunities, can any one of you throw some light on preventive cardiology per se and preventive oncology as a super specialty after MD community medicine?
So you want to have a career after MD community medicine into another specialty, palliative medicine, you said, I think?
No, preventive oncology, preventive cardiology.
Okay, yeah. So, see, as my co-panelist mentioned, that public health is a very vast discipline, very wide, So this is a challenge as well as an opportunity. Challenge in the sense that you have to study a lot, to get a grasp of everything. You have to study a lot, and that's why when people join community medicine or any other specialty related to public health, when they join and come to me for briefing, I tell them that now you have chosen the most difficult subject. If you choose cardiology, it's very easy subject, because it is only 500 gram of weight of your body. If you choose ophthalmology, it is 2 square inch on each side. You see, it's very easy. If you choose pediatrics, only you worry about children, up to 12 years of age. The rest you can forget. Whereas in public health, not only that you have to worry from head to toe, but everything else also which is outside the body. So our subject is so vast. So you have to study a lot. So it's very difficult subject. So this is the challenge. And the opportunity is that this subject is so wide and so many opportunities in it that you can focus on any part of it which you like. Just like one of my co-panelists mentioned, distinguish yourself. You like cardiology, so do preventive cardiology. If you like cancer, do palliative oncology or preventive oncology. So there is prevention in everything. So these specialties are well developed, and there are certain departments where even positions are available for preventive oncology or preventive cardiology. So you can very well do those things. This is my answer to you.
Sir, community medicine is a multidisciplinary subject, as you have already said. So in super specialization, like DM in a certain subject, so is it available anywhere in India? So it's all to all the panelists.
Hello. Yeah. This question that was being put up, I also one time I was very much interested in preventive cardiology. So I did some research in that thing. I was looking for, as the name suggests, preventive. You're always looking for prevention, but it is actually a misnomer, because to qualify for preventive cardiology, you have to be a MD in internal medicine. So that is not wanted. Okay, so that means we are not eligible for that thing, preventive cardiology. Though the name suggests preventive cardiology.
Okay, so this is it depends on different states, different medical colleges, but there are other places where, like Tata Memorial Hospital in Mumbai, who have preventive oncology, and they will take MD community medicine into that. There is my institution, ophthalmology department in All India Institute of Medical Sciences, also in the preventive, or they call it community ophthalmology, they will take community medicine. So there are some places where in these specializations also they will take community medicine, but you have to search and find out. Or if there are no places, if there are no positions, no places, you can create a place for yourself. You start something new and people will follow you. Our opening speaker mentioned about Tagore, and he said he has a very nice voice. I don't have that much, but I think he mentioned something Ekla, Chalore, something like that. So there is always a beginning for something new. So don't hesitate to start something new. As our compeer organizer is also mentioning, that there is no super specialization after MD community medicine. This is what he is saying. There is, maybe it is not there now, but who prevents us? In future we can create. Like there are some community medicine MDs who specialize in epidemiology. Some of them, they are now specializing in health promotion. Some are in health management. And who knows, in future, somebody might start a DM in epidemiology or a DM in health promotion or something like that. So that is the future. I think you youngsters, maybe after 10-15 years, might have DM in something. Any other questions?
Can I just add to this? You might not have a qualification specifically on this sort of course, but very often you can specialize with just experience. The fields that you're mentioning on non-communicable diseases is presently in the public health arena a relatively neglected field, the prevention bit of it. And from the UN perspective, I can say there is a lot of current focus on this, because the factors that contribute to all these NCDs, be it cancers or cardiovascular diseases, are pretty much similar. So working on the preventive aspects, working on the communications, working on behavior change becomes very essential. So maybe, in some of these things, if you do something on communication angle and link that to NCDs, that could be your forte. You could just make it there.
Any other one? Okay, now thank you.
My question, even though we tell it's public health opportunities, we talk only about MD community medicine. Public health is not only MD community medicine. There are other courses related to public health, MPH, TPH, MSc epidemiology, and people who from other fields, nursing, public health nurse, community nurse. Why there is no talk about them? What about their opportunities and their future?
So, very good question. Actually, public health is not only for doctors. Okay. Doctors are one part of public health. Public health is a very, as I mentioned, it has public health nursing, it has many other professionals, even statisticians, they work in public health, biostatistics, there is public health nutrition, behavioral scientists also work in public health, health education, as was mentioned by my co-panelist. So there are even lab scientists, there is a public health lab concept also. So different types of professionals, they are in public health. Somehow in India and in England, because this started with the doctors and medical field, other professionals who are our kind of in public health, they were neglected, to my mind. And what in future we should have a team concept. When a doctor can work with a pharmacist and with a lab technician and with a nurse, that is a team concept. In the hospital or in the clinic, there are different people who work, and then only we can serve the patient. Same way in the community or in public health, we have to have many types of people with varied qualifications, and they come together as a team. Then we can serve people better. And we need these people not at the highest level, which is DM level. We need at the MD level. We need at the MBBS level. We need at the nursing level, or we even need at the graduate level. And some of them we need at the even certificate course level. Somehow we have not developed, very high level specialists we have not developed, and below level also we have not developed. So our team is little bit incomplete. So I think in future we should pay attention to this whole team concept also. And there was one more, I think. Okay, while you are passing mic, our compeer, what do you call, organizer, you were speaking here, she mentioned one thing in her opening remarks. You see, there is some kind of identity crisis, This is also a problem, you see. Because many people do not know what is public health. They know what is child health. Bachcho ka doctor, child health. They know heart doctor. They know eye doctor. But they don't know what is this public health doctor. You see, so you ask when you go home, when you are traveling by train or by bus, you ask your fellow over there, what is public health? You just ask some people working in this campus that this conference is going on, what is this public health? You ask them. They will look here and there, they will not know what is it, you see. And the first thing is when you take admission into MD community medicine, when you get admission and you go back home and you tell your papa and your mummy and your boyfriend and girlfriend, they are going to say, what is this? What are you doing? For 5.5 years you are learning medicine, we had hopes that you will become a doctor, a big doctor in Calcutta. And what is this community medicine? So first thing is that. So identity crisis starts from there. So therefore, when students come to me on the very first day, I tell them that first thing is you should understand yourself. Introspection. You should understand yourself, what you are, what you are trying to become, and what you are going to do, what opportunities are there. Okay? And then only once you become, you know what you are, then you can explain it to others. So first thing I ask them, to anybody who comes to me, first day, I ask them, if you are a cardiothoracic surgeon today, how many surgeries you can do in a week, and in a month, and in a year, and in your lifetime? You can calculate that. Maybe it will be a couple of thousand. So this is only 5,000 people you can benefit in your lifetime. Only 5,000 people. And if you are a public health person, as our director was telling us, you are sitting in that board room, she showed you a picture, and they are discussing whether we should have rotavirus vaccine in our program or not. Many people are against it, but she is able to convince. 1 lakh deaths will be prevented, so many hospitalizations will be prevented, it is so much of vaccine cost, and there are our international partners, they also have lot of money which they don't know what to do with that money. See? And they are also ready with that cash, and there are some our international partners from Netherlands also, they also say this is good, and then Minister of Health or Finance Minister, he agrees with this, and they start this rotavirus vaccination in West Bengal. So you imagine how much suffering will be prevented.
And how powerful public health professionals are.
Yeah, and then see how many morbidities will be prevented, hospitalizations, and how many deaths, how much money will be saved, but on the top of that, how much suffering will be alleviated. How many more mothers will love their babies and will live happily with them. So this is the power of public health. I think we should realize it among ourselves and tell our mummy, papa and boyfriend and girlfriend that in their eyes, you see, I am telling you frankly, my father also felt the same. And then once he got to know this thing what I am doing, my brother is a gastroenterologist in New York. And he told him, why you are not doing the things which Rajesh is doing? So we have to persuade our near and dear ones and tell them that this is the importance of this subject. I think then this identity crisis will be over. Isn't it? And then, people will be rather, somebody asked me this question. One of my students asked me, sir, I don't know whether I should be in this specialty. I have second counseling, third counseling. I am thinking that I should change to pathology. I said, okay, you can do that if you want to spend rest of your life behind a microscope or behind a computer. You see, our colleague gave a suggestion that whether you want to spend your life behind a computer or a microscope. You can decide that yourself. But you see, this is the perspective. You have to
So
give
the irony lies, these people will do a master degree in clinical subjects and again they will do a 1-year PGDCM for public health just to advocate it in a public level.
Another thing I want to tell to our younger colleagues is, all those my classmates who were in that race to be in those specialties, now they are around retirement age. All of them are so much tired of seeing patients day in and day out. Same routine, same diarrhea, same ARI, same, for 30 years. They are fed up with this. And they say, then they become public health. They say, now what can we do, something different. So here in public health, you have this advantage that there is always novelty in your work. You are never tired of. Always new problems come up. If you solve the problem of HIV, some new disease is going to come and challenge you. So always your adrenaline will be secreted, So you will never be bored and tired of your work. This is another opportunity you have. Then last point I want to say is that, well, this is true. For living, we need some money. We all of us have families. All these things, career, money, all these things are important. But I assure you, as a human being and living in a human society, you are not going to starve. The people with whom you are working and people for whom you are working, they will always be supportive of you. So have confidence in yourself. I have not seen any public health person so far who is unemployed. There is shortage of public health professionals all over the world. There had been 50 years ago also, and there will be 50 years from now on. Because the more and more, we are developing, we are surviving longer and longer, isn't it? And we want to survive even longer than that. Okay, so the societies, when they are developing, they are becoming more healthy, with passage of time. So there is a need for public health is going to increase in future also. And the more our societies evolve, how are we going to judge that we are very good society in our country? What is the yardstick? The yardstick is that the societies are ultimately going to be having a status of health which will be much more similar among all the people. Now there is so much of inequality and inequity that there are some people in Japan, how many? They don't die. Huh? What is the life expectancy in Japan? 82, 83. It's very difficult. They don't die. They go up to 100, 125. In Netherlands, do they die? Or they also live very long. You see, when I was born in 1954, life expectancy in India was 47 years. Now it is 70 years. All of you are going to survive more than 100 years. And your children will be 125 years. Okay. So, and on the other hand, there are countries like Congo. Average life expectancy is 45 years. This Ebola, why Ebola is arising over there? There is health system crumbling. There is so much of inequity. So we have a world which is so inequitable. So this is on us, all the public health people. We want health equity. We want right to health for everybody, right to health care, so that anybody who by mistake was born in a slum, it is a mistake. We would not like to commit that mistake, given a chance. Will we? We would like to be born if we are given a chance in Netherlands or in Japan or somewhere else, but nobody asked us before taking birth. So this is by chance, So that we want ultimately, this is public health, I tell you, no other specialty. This is public health people who have this sense of justice, who want every human being to survive with dignity, you see. And we are the ones who have this slogan of right to health and right to health care, isn't it? Among all the specialties, you see. And that is our universal health care. So therefore, you have a lot of opportunity for making contribution in this world, whether you get paid in dollars or rupees or in whatever. And don't worry, all of you are going to do well. Thank you very much.
Thank you all the speakers. Sir is so tall. Thank you all the speakers. It was really motivational, and I really hope this helps these undergraduate students over here. Can someone please come up and say something? Like undergraduate students, that how this program has motivated you all. Please, anybody. Please, someone volunteer. Come, someone please come.
I just want to take just 1 minute. The thing is, I can see some of my colleagues over there in the audience. So I just want to impress upon one thing which I forgot in my presentation, is that in the government sector, from the perspective of government sector, I can say that we always say about bureaucrats, but we also need to know the term technocrats. We as medical professionals can act as technical experts in administration and can act as technocrats who will be guiding those bureaucrats and frame the policy. As we can say, why I mentioned it is because, like, if we see the National Health Service in Britain, why they are so successful, why they have been able to bring preventive medicine into their arena, is just because of this thing. So I would like everyone, and I would like to encourage everyone to come to this arena.